Hello everyone. In this video we are going to look at the joints. We are just going to highlight some of the major features of the joints. 3 major joints in the forelimb and 2 major joints in the hind limb. So let's start looking at the shoulder joint first. So here we see the lateral view of the shoulder. The spine of the scapula can be seen here. The scapula with the distal end, as we have your glenoid cavity, and the head of the humerus making up the shoulder joint, classified as simple synovial joint. Structurally, ball and socket, where the ball as a head of the humerus and socket as a glenoid cavity, they fit into each other, forming the ball and socket joint. Structurally, though it is ball and socket, the movements are limited in the quadrupeds. As we know, the active ligaments which are going to limit those movements. At the same time, it is going to strengthen the joints. So, the ligaments which are associated with the shoulder, as we see the lateral view of the shoulder coming from the distal part of the scapula, we have lateral glenohumeral ligament, which is slight modification of the joint capsule, not as obvious as the other collateral ligaments we see in other joints. So this is your lateral glenohumeral ligament. Now as we turn it on the medial side and we look at the medial view of the shoulder, so we can see the joint a little bit more exposed. The lesser tubercle of the humerus is seen here. The greater tubercle is seen right here, more on the lateral side, and we see the head of the humerus with its articular surface. We can see clearly the articular cartilage on the surface of the articular surface of the humeral head, and on the medial side we see this another modified part of the joint capsule, which is your medial glenohumeral ligament. The supraglenoid tubercle, serving as point of origin for the biceps brachii muscle that we see down here. The tendon is passing through the intertubercular groove, which is secured here by means of the transverse humeral ligament or transverse humeral retinaculum. The another general features of the synovial joint that we observe in this particular joint, we can see the articular cartilage lining the glenoid cavity, as well as articular cartilage covering the head of the humerus, which takes part in formation of that articulation. We see the long head of the triceps brachii muscle, basically attached to the caudal border of the scapula, inserting further on the olecranon tuberosity of the ulna. The bursa, which is going to be located here, is your intertubercular bursa, also called bicipital bursa because it is associated with the tendon of the biceps brachii muscle. The cubital joint, we see the cranial view of the cubital joint, the lateral view of the cubital joint. Going further upward, we can see the lateral spine of the scapula. So we are on the lateral side. So we see the musculospiral groove or brachial groove of the humerus, the lateral epicondyle of the humerus. And so here we see the cranial view of the cubital joint. The distal end of the humerus, we can see the trochlea of the humerus as well as the capitulum, which is more lateral part. Still, as it is part of the articulation, it is covered by the articular cartilage. In front, we see the ligament running from the lateral to medial aspect, that is the oblique ligament. This ligament is going to be the one which is for prevention of the overextension. It runs through the trochlea of the humerus, comes from the radial fossa, inserts on the proximal end, more on the medial side of the radius, that is the oblique ligament. Another ligament that we see in the cubital joint, running from the lateral coronoid process of the ulna to the medial coronoid process of the ulna, that is going to be the annular ligament of the radius, located or around the proximal end of the radius, stabilizing radius and ulna together. Moving further on the lateral side, the probe is now underneath the lateral collateral ligament of the cubital joint. Now the probe is going down, it's underneath the lateral collateral ligament, so that is your lateral collateral ligament. As we go further on the medial side now, we have the medial collateral ligament. The medial collateral ligament of the cubital joint is located right here. Going further on the caudal aspect of the joint, we can still see the articular areas or articular surfaces. The trochlea of the humerus is making contact with the trochlear notch of the ulna. The ligament which runs between the humerus and the olecranon tuberosity will be your olecranon ligament. And the bursa, which is located underneath the tendon of the triceps brachii, olecranon bursa. And those are the major features of the cubital joint in the dog. Moving down further to the carpus of the dog, we see the carpus from the dorsal aspect. The extensor retinaculum is disrupted here, so the common digital extensor has displaced. This is how it's going to be when the extensor retinaculum is in place. Your common digital extensor, abductor pollicis longus muscle. The extensor carpa radialis is located right below that. The dorsal surface of the carpus, which is going to be the extensor surface of the carpus. Extension of the carpus in this way, flexion of the carpus that way. So upon flexion of the carpus, we expose the cavities of the carpus. The three major joint cavities that can be seen: the antebrachiocarpal joint cavity, the middle carpal joint cavity, and the carpometacarpal joint cavity. The antebrachiocarpal joint cavity is the most movable joint. Then middle carpal is a little bit less movable than that, and carpometacarpal is the least movable joint. Some other features associated with the carpus, those are going to be like on the caudal aspect or on the palmar surface of the carpus, you see the flexor retinaculum stabilizing the flexor tendons in place. Going deep to that flexor retinaculum, we will expose the carpal canal, and along the floor of the carpal canal you find the palmar carpal ligament, which is thickening of the joint capsule of the carpus. Coming down further, we can see some of the ligaments some of the ligaments and tendons which are located in the phalanges. This is the level, or this is the place where you see the metacarpophalangeal joint. Then that is your proximal interphalangeal joint located here, and distal interphalangeal joint located further below that. From the dorsal view, we can see all three joints again: the metacarpophalangeal joint, the proximal interphalangeal joint, and the distal interphalangeal joint. All these three joints are going to have collateral ligaments, but here those are called abaxial collateral ligament on the abaxial side, axial collateral ligament on the axial side, abaxial, axial, and so on. Another feature of the distal interphalangeal joint, which is more important in terms of comparison between the dog and cat, we see the dorsal elastic ligaments, the one which is been highlighted. The probe is now underneath one of those dorsal elastic ligaments. So that's the dorsal elastic ligament. In this also we can see the same dorsal elastic ligament. One is right here, another one on the other side. Going on the palmar surface, we see the annular ligaments. So at this level it is going to be your palmar annular ligament, which has been reflected right here to expose the DDF and SDF tendons. So that ligament here is your palmar annular ligament. As we come one step below that, we have another ligament at the level of proximal phalanx, that is your proximal digital annular ligament, and the one which is located below that is the distal digital annular ligament. In the hind limb, structure is going to be same. So we have plantar annular ligament instead of palmar in the hind limb. The proximal and distal interdigital ligaments, their names, they remain same in the forelimb as well as hind limb. In this particular digit, that is digit number 2, we can see the proximal digital annular ligament is intact, as well as distal digital annular ligament is also intact in that, stabilizing the deep digital flexor muscle at this level, as well as superficial and deep digital flexor muscles at this level. Pulling these two tendons away from each other, we can see the relation between the SDF and DDF, deep digital flexor, coming down further to the flexor tubercle of the distal phalanx, while superficial digital flexor having that bifurcation or having that flexura menica or menica flexura, allowing passage of the deep digital flexor further beyond the superficial digital flexor muscle. So this is the tendon of the superficial digital flexor, and this is your deep digital flexor tendon, which is indicated now. The hind limb of the dog, joints of the hind limb. The hip joint, basically made up of acetabular cavity of the pelvic bone and the head of the humerus. The greater trochanter can be seen here, the lateral view of the hip joint, the quadriceps femoris muscle, the vastus lateralis head, the hip joint or coxal joint. As we can now see in the medial view, we can see some important ligaments associated with that. So exposing the articular surface of the head of the femur. We can also see the fovea capitis, where the ligament of the femoral head or round ligament of the hip is attached here. Coming from the acetabular fossa, the ligament inserts on the fovea capitis of the femoral head. Looking at the rim of the acetabulum, the acetabular notch is going to be present right here, and that notch is completed by a ligament which runs across the notch, which is your transverse acetabular ligament. So two important ligaments we saw in the hip joint, the round ligament of the hip or ligament of the femoral head, as well as the transverse acetabular ligament. The acetabular lip is going to be around the rim, deepening the acetabular cavity with cartilaginous structure associated with the rim. So that's your transverse acetabular ligament, and that is your ligament of the femoral head inserting on the fovea capitis of the femur. The neck of the femur, the stifle joint of the dog. We can see the cranial view of the stifle joint here, as well as the caudal view of the stifle joint. Some of the muscles are left in place in this specimen for the purpose of orientation. We can see the caudal view of the stifle joint. Femur, proximally the bone femur is involved, distally the bone tibia and fibula are involved. So we see the popliteus muscle with its tendon going more laterally and proximally towards the popliteal fossa of the femur. Right in front of that we have extensor fossa of the femur, where the long digital extensor muscle originates from. We see the ligaments associated with the stifle joint as well. First of all, we see the femoropatellar articulation, the articulation between the patella, the bone which is, or the sesamoid bone which is located, or which can be seen more clearly from inside. This is the articular surface of the patella, the trochlea of the femur, smooth gliding surface for gliding of the patella, the patellar ligament which has been transected here, which will continue further to the tibial tuberosity. On the lateral view, we see the lateral femoropatellar ligament. Now we are talking about the femoropatellar articulation, one of the component articulations of the stifle joint. So we have femoropatellar articulation from femur to the patella on the lateral side. Similar ligament is present on the medial side, which runs from the femur to the patella. That is your medial femoropatellar ligament. So this is medial femoropatellar. This is lateral femoropatellar, tendon of origin of the common digital extensor, long digital extensor muscle, and tendon of origin of the popliteus muscle located more laterally between the or below the lateral collateral ligament. Coming to the next component articulation between the femur and the tibia as well as fibula, femorotibial articulation involving condyles of the femur, the intercondylate fossa located in between the condyles. From the caudal view, we can still see the similar structures. We have the condyles of the femur, intercondylate fossa, the sesamoid bones, fibula, the lateral one, the medial one, the popliteus muscle again located distal to the stifle joint, but the tendon crosses the stifle joint and goes more proximally on the cranial aspect of the femur. Let's look at the ligaments of the femorotibial articulation. From the cranial view, we can see the cranial cruciate ligament, the medial meniscus, the lateral meniscus, the tibial tuberosity, the cut part of the patellar ligament. This is the place where you see part of the caudal cruciate ligament, the cranial cruciate, and the caudal cruciate. More flexion of the stifle joint. You can see the cranial cruciate ligament right here, and the caudal cruciate ligament right here. Remember, the ligaments are named according to their insertion on the tibia, not on the femur. So that is your cranial cruciate ligament, and part of the caudal cruciate ligament can be seen from the cranial view as well. Turning it to the caudal aspect, you can see the caudal cruciate ligament right here, moving or crossing the cranial cruciate ligament, going further on the cranial aspect of the femur. The ligament which is present between the lateral meniscus and the femur, that is your meniscofemoral ligament. The medial meniscus can be seen again. The lateral meniscus is located below the tendon of the popliteus muscle, so not clearly visible from this way. Coming back to the medial view of the joint, we can see the medial collateral ligament makes some sort of attachment with the medial meniscus, providing some support. Then we have the lateral collateral ligament of the stifle joint, which does not connect to the meniscus, and so we need additional support to the meniscus by means of meniscofemoral ligament. The lateral meniscus and the